For more on the reopening of the economy, let's bring in Steve Odland. He is the CEO of the Conference Board, and David Neeleman. He is the founder of JetBlue Airways. Gentlemen, it's good to have you with us. Steve, to you first. Your response to the president's plan this evening.
Well, I think these principles are very sound. I think that we're right. We need to reopen the economy as quickly but as safely as possible. Clearly, there's no price that you can put on a human life. We don't want to risk the virus reaccelerating. But there's also a human cost to staying closed, and psychological, other medical issues, and clearly economic. And so by shutting this down, we've created for ourselves the greatest economic disaster since the Great Depression. And we need to make sure that the cure isn't worse than the disease. So, these ideas of opening geographically, where you have a fourth of the counties in the United States that have had no cases and 20 or 30% that have zero in the last week, geographically we can start to open. You can also open any business that is virtual. There's no reason to not operate a virtual. And then, as long as you've got these social distancing procedures, hand sanitation, masks, and so forth, and that continues, then you can begin to open voluntarily even broader than that. So I really endorse the guidelines of opening. We cannot keep this economy closed for the long term.
David, are we taking safety into consideration enough, or are we moving too fast?
I think there were a couple of things about the guidelines I really, really liked. Number one is the focus on those that are actually dying. We've read in New York that 25%, and across the country, 25 or even more percentage of the people are in nursing homes. You could have flattened the curve 25% just by protecting nursing homes. So that's number one. And, number two, in the guidelines, making sure that, we're protected, and that's good. But one of the things that concern me about the guidelines, and I'm trying to, and I listened really intently, I heard it all, is, I didn't hear anything about, this 2-week decline. This virus is extremely contagious. And what we know from lots of studies, I could sit and name 10 of them that I read every day, that up to 90% of the people are asymptomatic. So it's very difficult to contact trace. And so you have the spread amongst people who are not having any symptoms. So if someone jumps up, what do you do then? Because I don't think once we come out of quarantine or shutdown, I think it's going to be very, very hard for the numbers to continue to go down. Now, the good news is that now we have antibody tests, so we can actually start doing surveying of people. There's going to be a test that will come out any day now from Santa Clara County in California. There's other tests that are coming out all over the world that are showing the denominator it could be off by as much as 20 or 30 times, which reduces the death rate by 20 or 30 times, which gets it down. So I think if we knew that for sure, I think the policy could be relaxed a lot quicker, and I think that's what's going to happen. I'm confident that's what's going to happen.
Steve, this line that you and others use, the cure can't be worse than the disease itself. It's a catchy talking point. I get it. But there's not enough testing as we speak right now. And to David's point, wouldn't the worst thing would be to open too quickly and then have to shut everything down again? That will crush the economy, won't it?
You don't want to do that because that would destroy all trust as well. So that's clearly something that would be bad. But at the same time, listen to what David's saying. I mean, if 90% of the people are asymptomatic, it means that the people who are affected are really in the vulnerable populations. We can deal with that. We can create the distancing and continue to keep and protect our nursing homes, people with vulnerable situations, with immune deficiencies and so forth. But then for the rest of us who are 90% are asymptomatic, I suspect what they call the herd immunity is going to be enormous at this point. And this is why, David's point on the testing of the antibodies becomes so important. But look, I don't think we should rush into anything. We don't want to risk lives, but at the same time, you have to take and account for the social costs on the other side of it. So we have to get going here in a metered fashion in the lowest risk area.
In other words, David, 2 extra weeks now would be better than 2 extra months in the fall, would it not?
Well, like I said, I'm confident. I've read 20 reports. I'm confident that when you take the new denominator and you divide it, what I'm saying is, first of all, fix the denominator and then get to know the numerator. So the first step is doing the antibody testing. Dividing, if you divided today's number by 20, we're close to what the mortality rate is for the flu. in the U.S. But then we know that it's very tough on some people with some certain underlying cases. There was a study done by John Ioannidis from Stanford that said if you're under 65 and healthy, your chances of dying of COVID-19 are greater driving to work than they are getting COVID-19. Now, we know people with COVID-19 are getting sick below 65. We know there's a load issue. We know all that stuff. So get to know the numerator, find out who's dying, find out who's most at risk, those that have, healthcare professionals that are constantly being bombarded, fix the denominator. And then I think we don't need to worry about opening and closing, because then we have to, the other thing I liked about the plan the president had tonight was making sure the hospitals can handle it. But if you know the denominator, and you know who's getting sick and you're protecting them, it's much easier to protect hospitals and know the rush. I mean, I'm a little long-winded here, but when Governor Cuomo said he needed 30,000 ICU beds and 1% of the people were infected, that was a rational number. But what we knew is that he peaked out about 5,000 ICU beds because, I believe when the testing comes out that, maybe 20 or 30% of New Yorkers have already been infected, have already had the antibodies.
Yeah. And Steve, if you're a CEO tonight, are you planning on testing everybody who comes in, your employees? Are you testing every single employee who comes back to the office? Are you testing every single customer, if you could, who comes into your store?
These are the issues. You can't, and because the testing isn't available. It's just the lab testing. We're just coming out with these tests that prick your finger and you can get it in 5 minutes. But those aren't out there yet either. So I don't think you can put that on employers. I think you've got to have still the local and state governments to give us guidelines here. Look, I think it's got to happen geographically. There's a lot of areas of the country which could contribute to more than half of the GDP that could open right now. But then maybe hotspots, like Cook County, like Monroe County, like the New York City county areas. Maybe you go a little slower there for the vulnerable populations. Go a little slower. But I think that the remdesivir, hydroxychloroquine with the Z-Pack, these are things that are showing promise. And as long as we have some sort of treatment to it, and you're not going to die, then it's no worse than the common cold. It's no more risky. So yes, we can't just say it's safe to go back in the water if the sharks are still there. But if the sharks have gone away, you can say it's safe to go back in the water. It doesn't mean the sharks aren't in the water. It just means that they're not close to you. And I think we have to approach the illness the same way here.
Even the medical experts, though, suggest that, to use your analogy, the sharks are going to be with us for an awfully long time. Perhaps they come back in mass in the fall. Gentlemen, it's good to have you with us tonight. I appreciate it very much. David Neeleman, Steve Odland, we'll talk to you again soon. Let's bring back in Dr. Scott Gottlieb. He's with us now. So we've had a chance to see the president's guidelines, Dr. Gottlieb. They're going to come in 3 phases. What do you make of them tonight?
Well, let me just, if I can, pick up on the conversation you just had. If we look at New York City, for example, guest was talking about the denominator. If you assume every single New Yorker had COVID-19, all 8.399 million New Yorkers were infected with COVID-19, the case fatality rate with 11,000 people dead in New York would be about 0.14%, which is more than seasonal flu. Seasonal flu is anywhere from 0.05% to 0.1%. If you assume about 1 million New Yorkers had COVID-19, which is probably a fair assumption at this point, I would submit I think probably about 1 million New Yorkers have had it, even though we've only diagnosed 100,000 people. We're probably only diagnosing 1 in 10 to 1 in 20 people. But if you assume 1 million people had it, then the case fatality rate in New York right now is above 1%, and it's overwhelmed the New York City healthcare system. So that's the pathogen we're dealing with. This is a fearsome pathogen, make no mistake. And I agree that we're undercounting the denominator. But even if you allow for the fact that we're undercounting the denominator by a factor of 10, you're still looking at something with a case fatality rate that's 10 times worse than flu, which is what we've been saying all along. As far as the guidelines from the president tonight, I think they're by and large in line with what we expected and what we've been talking about on the show for a number of nights, and that they're broad guidelines to the states that give the states a lot of latitude, and I think are wholly consistent with what the governors are considering doing right now within their own states. There's a couple of things on there that I think states are going to go a different way. When the guidelines talk about reopening large sports venues, I suspect most states are going to exercise more caution, especially in phase 1, what the guidelines describe as phase 1. I think when the guidelines talk about the ability to reopen gyms with proper sanitation in place, I suspect a lot of states are going to keep entertainment types of venues closed for a longer period of time until they make sure they can safely return people to work. I think the priority is going to try to be to return people to offices, to shop floors, to industrial jobs, manufacturing jobs, and make sure you can do that in a safe fashion and not see an uptick in cases before you start opening up entertainment types of venues.
Elective surgeries I'm looking at in terms of phase one, which obviously had been put off or canceled or not allowed altogether to make room in the hospitals for those who needed it for COVID, those can resume as clinically appropriate. Is that a good idea?
Well, I think it's something that's appropriate in the setting of, declining infection if you think that you have the hospital capacity to allow for it. Remember, the guidelines specifically state the importance of making sure you have capacity back in the healthcare system. There's going to be some places of the country that are so overwhelmed by this, the healthcare systems have been so overwhelmed, that they're not going to have the reserve capacity to resume non-urgent procedures for a longer period of time, and I'm thinking particularly of New York and other hard-hit cities like New Orleans. But in other parts of the country, we haven't seen a lot of spread, where the healthcare systems haven't been burdened, and a lot of Midwest hospitals right now are very empty. Those hospitals can probably think about how to safely return elective procedures to the hospital setting with heightened infection control procedures to make sure that the virus isn't going to spread within an institutionalized settings. But there are a lot of parts of the country that haven't been hard hit by this, where there hasn't been spread, where the hospitals do have reserve capacity because they haven't been overwhelmed by cases coming in. And remember, this is a very diverse nation, and the experience of this virus across the nation has been highly variable. And so I think that you're going to see governors take a tailored approach and mayors take a tailored approach based on what's happening in their specific regions.
Let me ask you a quick question before we go, if I could, Dr. Gottlieb, on the origins of this virus. And NBC News is reporting tonight that U.S. intelligence is investigating the possibility that the virus came from that lab in Wuhan and it was released accidentally, perhaps from a person there who may have been infected and then spread it. One official telling NBC News this evening it's a possibility, though not the most likely possibility. What do you think?
Well, I think that sounds about right. It's a possibility, but not the most likely possibility. That possibility has never been discharged, and our senior officials who have seen the raw intelligence have never been willing to refute that publicly. So I think that it's something that until we get the source strains and understand what the index case was and are able to sequence that index case, we're not going to know for sure. But that lab always had a bad reputation for controls. There were articles written about that lab when it first opened, about concerns around biosafety in that lab. There were now State Department communications that were leaked to the Washington Post that seemed to affirm that. That lab always had a troubled reputation, and we know that that lab was doing experiments with coronaviruses. And so the possibility that someone accidentally infected himself with the virus because of the poor controls in that lab and became patient zero, I don't think can be fully discharged.
Dr. Gottlieb, good to talk to you as always. We'll see you soon.
Thanks a lot.